and welcome to Prescription for the Cure, a panel where we're going to discuss smarter healthcare coverage in Florida. I'm David Christian, the Florida Chamber of Commerce's Vice President of Governmental Affairs, and I've had the good fortune to cover healthcare for the last 2 sessions with the Chamber. And because of the work of the Chamber members over the last couple of sessions, we are making a difference in Florida, and we're making Florida more competitive by talking about healthcare and talking about it from a business perspective. The work that's been done by the Florida Chamber has resulted in this year's comprehensive healthcare policy called Smarter Healthcare Coverage. And this is a copy right here, a picture on the front of our brochure that's on our website that explains our 7-point comprehensive plan. The policy is really focused on ending the $1.4 billion cost shift and making healthcare more affordable for Florida families and businesses. And we prepared a short video that makes our point. And why don't we watch The Cure? Can you run the video real quick?
Healthcare. These days, it's so complicated and confusing, it just might make you sick. Like the Affordable Care Act, or as some people call it, Obamacare. It was supposed to remedy our healthcare ills. Instead, it's making them worse. Obamacare's 20,000 plus pages of regulations only means more confusion, higher costs, and uncertainty about health insurance options for Floridians. It's a textbook case of right problem, wrong solution. With Florida's families and small businesses forking over $1.4 billion in hidden healthcare taxes each year, it's time to stop shifting costs and start making healthcare more accessible. And the best way to make Florida's healthcare more accessible is to make it more affordable. Floridians deserve smarter healthcare coverage, reducing bureaucracies and fraud, stopping frivolous lawsuits, and enlarging the role of professional nurses in delivering care are all steps in the right direction. It's also time to update healthcare for the 21st century by allowing you to consult with your doctor and even receive prescriptions online. Sure, when it comes to healthcare, Washington might be making us sick, but Florida can be part of the cure. With billions in low-income pool funding at risk, the time for a cure is now. Help heal Florida's healthcare system by sharing this video. To learn more, visit floridawins.org.
Boy, that probably gets a lot of people's attention, and I hope it got your attention. And you can also look at this at floridawins.com. You may know Florida Wins is a great resource for employers to share important issues with their employees. And healthcare is an issue that everyone has an opinion on. And as employees experience higher out-of-pocket costs, bigger co-pays and premium increases, it's important that they are informed about the policies that impact their bottom line and their wallets. Okay, to the panel discussion. First, I'd like to introduce our speakers. Audrey Brown. Audrey is the president and CEO of the Florida Association of Health Plans. And Brown has held leadership positions in both the private and public sectors and has over a decade of insurance, legislative, and regulatory experience. Most recently, Audrey served as the Chief of Staff to the Florida Insurance Commissioner, Kevin McCarty, where she was Chief Policy Advisor to the Commissioner, Chief Lobbyist on agency fiscal matters, and managed the operations of the Office of Insurance Regulation. Additionally, Audrey has served as Deputy Chief of Staff to the Commissioner and as Director of Government Relations. Prior to that, Audrey worked for AvMed, which is a board member of the Chamber, and she began a professional career serving Governor Jeb Bush. Audrey is a proud graduate of FSU, and she has a degree in Bachelor of Science in Political Science. So welcome, Audrey.
Thank you.
Next is Kelly James. Kelly is the Senior Manager for the Florida Blue Center for Health Policy. He leads a team in the review of healthcare topics to identify policy and operational impacts. He participates in industry work groups to provide input on the impacts of healthcare reform provisions to regulatory agencies, and he also develops and delivers educational materials on healthcare topics to various audiences. Welcome, Kelly.
Thank you.
And Kelly also holds a bachelor's degree in business administration and a master's of business administration from the University of North Florida. He's also certified as a project management professional. Welcome, Kelly. And last but not least is Janet Dubois. Dr. Dubois has been a family nurse practitioner for over 20 years and has extensive practice experience in emergency care, rural health, retail health, and family practice. She also has a lot of letters after her name. She's an assistant clinical professor at the University of Arizona in their Doctor of Nursing practice program and maintains a part-time independent practice in Bradenton, Florida. Dr. Dubois is a fellow of the American Association of Nurse Practitioners and a distinguished practice fellow of the National Academies of Practice, an interprofessional organization that advises national policy leaders and stakeholders on healthcare. She is president of the Florida Nurse Practitioners Network and the president of the Manatee Area Council on Advanced Nursing Practice. Dr. Dubois has been extensively involved in health policy and legislative activities and has held various leadership positions for most of her career. She currently resides in Bradenton. So let's welcome our panel, and let's focus in on healthcare. How did the chamber get here? We have this great policy that I hope many of you have looked at. And we actually formed a task force last fall at the direction of our new chairman, Steve Knopick. And it was made up of board members and local chambers. And we met throughout the fall and took a careful look at Florida's situation, and we recommended a 7-point plan for making Florida more competitive to mitigate our concern over the growth of entitlements. And this is called the Chamber's Smarter Healthcare Coverage for Florida. It reduces and eliminates the cost shift on Florida's families and small businesses by addressing the cost equation. By putting solutions in place that will not simply alter the funding mechanisms, we can build on Florida's quality of life and a friendly atmosphere by covering more of Florida's uninsured. And that's what we're really going to talk about today, is how do we look at healthcare for the 21st century, looking at innovations, new technologies, as well as new policies that will increase access to care, control cost, and provide better outcomes. So with that, I'm going to ask Audrey to go first. And as the leader of the Association on Healthcare Plans, she lives this day to day. And I'd like her to talk about the current situation with healthcare insurance rates. And Audrey, please take it away.
Thank you, David. I appreciate the opportunity to be here before you. Again, I'm Audrey with the Florida Association of Health Plans. We actually represent 18 nonprofit and commercial licensed health plans across Florida, as well as the public plans and Medicaid HMOs. Our mission is to better the health of Florida citizens by promoting the growth of health plans dedicated to providing the best service, highest quality of care, and best value and affordability. It's my privilege to be here to talk about the state of healthcare in Florida. And as all of you know, we are at a critical time as the state and country undergo an historic transformation to our healthcare delivery system. There are dramatic and dynamic changes currently underway in our marketplace. Some of these changes are Florida initiatives, such as the statewide Medicaid managed care program, which leverages successes from other parts of the healthcare industry, such as comprehensive coordinated care and quality outcomes. There are also federal initiatives that we've discussed, most notably the Affordable Care Act, whose supporters claim is the most important social legislation since the Great Society programs or even the programs initiated during the Great Depression. In Florida, the Agency for Healthcare Administration has completed its enrollment of nearly 3 million Medicaid recipients into the Medicaid Managed Care program. To put this into perspective, this program just enrolled 1/6 of our state's entire population. And at a cost of roughly $23 billion a year, Medicaid represents nearly 30% of Florida's entire $77 billion state budget. And we look forward to the success of this initiative and continuing the good work with our partners to ensure the long-term viability of this program. I'd like to pivot a little bit. Obviously, in Florida, we have not expanded Medicaid. However, Florida health plans do support changes to the existing system that would fill the coverage gap for the population that is not currently Medicaid eligible, but who are the working poor and uninsured. At the same time, we also understand the underlying concerns raised by many state policymakers about expanding an entitlement program that impacts the state's budget. At the same time, I'd like to say that if the legislature moves forward, we do believe that the Agency for Healthcare Administration and existing Florida health plans would be ready to deliver and enroll those people. As I referenced before, the agency has just completed a mammoth task over the last 18 months to procure managed care plans, establish networks, and create the infrastructure for statewide Medicaid managed care. And we believe that this infrastructure could easily be leveraged to cover a significant number of additional Medicaid recipients. Depending on the complexity of the program design, implementation timeframes have varied from as little as 4 months to as long as 12 months post-legislative approval. So the association and our member plans look forward to continuing the dialogue. There was a panel discussion yesterday in the Senate to discuss expansion, coverage options, and implementation. And we hope to hear more of that dialogue as we go through the legislative process.
Well, thanks, Audrey.
Oh, and I wasn't quite finished.
Oh, sorry.
I was just going to pivot.
You paused.
No, I'm
Okay.
sorry, I did pause. I just wanted to go through a little bit, though, on the implementation of Obamacare, Affordable Care Act, just
Cool.
for the group. We've all now been introduced to new standardized metal level products and an expanded role of the federal government in determining how insurance is purchased and sold. We have a federally facilitated insurance exchange in Florida, expanded benefits and new taxes to pay for those benefits. And together, these changes have created uncertainty in the marketplace as both the private industry and regulators struggle to transform a broad framework outlined in the 2010 national legislation into a workable, transparent, and fair health insurance system, despite political disagreements. In Florida, there are now 14 participating companies on the federally facilitated exchange in the individual market. Premiums for individual plans selling these policies, these ACA-compliant policies, we'll call them, will go up an average of 13.2% in 2015. The increase in premiums in 2015 comes on top of a 37% average increase in the combined individual and small group plan rates in 2014. And even with federal subsidies, Floridians are seeing healthcare costs and out-of-pocket expenses rise, not fall. The Florida Office of Insurance Regulation has not had rate approval authority for the last 2 years of ACA implementation, but this year the office will require filings to be made through their processes for approval. Our association is working with the office as we kind of move forward to this new process and understanding what it is that we'll have to provide to the office for these rate filings. And in conclusion, these dynamic and dramatic changes have been as controversial as they've been revolutionary. Yet regardless of your political persuasion, it's essential that we make these changes work for all Floridians. Whether it's reforming the 50-year-old Medicaid program or attempting to implement federal health care reform, the next few years will be critical to the future success of our state. A successful healthcare system is essential for a productive workforce, a competitive business environment, and to make Florida an attractive place for everyone. We can only achieve this goal through a healthcare system that improves outcomes while achieving efficiency. Representing roughly 20% of our state's gross domestic product, healthcare is and will continue to be essential to Florida's continued economic success. And thank you, David, for having me, and I look forward to hearing from my peers on the panel and answering any questions.
Thanks, Audrey. I'd be remiss not to talk about the Senate Health Policy Committee meeting yesterday where Mark Wilson presented our 7-point plan. And what's really, I think, a compelling factor about the Chamber's plan is that we're actually talking about reducing healthcare costs in the state if you implement our 7-point plan. And one of the key factors in our plan is to limit the growth of Medicaid to 32% of the overall state budget. This past year, Medicaid is at 29% of the state budget. And I think with the controls that we've recommended, we can get there even in the out years when the federal government picks up less of the expansion plan. So we're very supportive of efforts to control cost if we do accept federal dollars. I wanted to make that clear. And so the 32% is a threshold that we absolutely will hold dear. And the other component of our plan is to actually give back to ratepayers, to Florida's families and small businesses, in terms of savings on their premiums. And there's a couple of mechanisms that we recommend in our policy to do that. And so there's a lot of parts to that, but we think we can achieve some real cost savings. So on the cost side, we just heard from Audrey, and now we're going to pivot to the delivery side. And Kelly James is with Florida Blue. They provide, obviously, insurance to a majority of Floridians. They're also very invested in how do they deliver health care in a more efficient and innovative way. And one of the key factors to do that is to deliver better and greater access to primary and preventative care. And Kelly's going to talk about this notion of medical homes. And so, Kelly, I won't steal your thunder, but
No, that's okay.
Go ahead and jump into that.
All right, thank you, David. Thank you for the opportunity to be here this morning. As David mentioned, my name is Kelly James. I'm from the Florida Blue Center for Health Policy, and Florida Blue serves over 4 million people in the state of Florida, and our mission is to help every Floridian achieve better health. And so one of the strategies we have taken over the last few years to accomplish that is back in 2011, we established a new care model called a patient-centered medical home. And that is where a patient's primary care physician directs members to specialists, to facilities, to testing organizations to make sure they get the most efficient care possible at the lowest possible cost. And the idea behind these patient-centered medical homes is that the primary care physician serves as a coordinator for all that service, gets people in the right place to get the right services performed, and then follows up with those practitioners or those providers to get data about the testing or the specialist visits that were performed to better coordinate the care among all of those practitioners to make sure that member is treated with the most effective methods possible. That started again in 2011. We have over 2,500 physicians throughout the state participating in this program, serving nearly 1 million members through this process. And what we help the providers do is the primary care physicians get specialized data on the treatment of those members, the treatments they receive, the facilities they visit, and they get feedback that then helps them understand what treatment plans work, what treatments don't, how they can direct those members to more effective methods of treatment. And those providers are then evaluated on their performance based on how the members feel about the care they've received and if they have actually lowered the cost of providing that care. And so what we have seen since the program began is we have seen what we refer to as a per member per month cost. How much does it cost to provide care to a member? We have seen that cost go down $14 per month for each of the members on average in that patient-centered medical home model. What that equates to in real dollars in terms of medical cost expenses is over $48 million a year. So that is a significant savings in terms of unnecessary cost for medical care. And we are also seeing improved rates in terms of readmissions for hospitalization. We're seeing more preventable admissions for services. People are not having to go to the hospital as much for care and treatment. So we think this type of a model, this gets away from the traditional fee-for-service model where providers are reimbursed based solely on the tests and services they provide, to more of this value-based model where reimbursement is based on how effective that care is for the member as well as how cost-effective it is from an outcome standpoint. So that's where we're headed in terms of trying to expand that model across the state.
Great. Well, thank you, Kelly, for that. And next, we're going to hear from Dr. Dubois. She'll discuss a critical component of our healthcare delivery system and of our plan, and that is to ensure that we have an adequate supply of medical professionals. And nurse practitioners are a very highly skilled, highly trained group of medical professionals that deliver care to our state. And Dr. Dubois, talk about the importance of nurse practitioners in our system and how we can leverage nurse practitioners going forward using all the things that we just talked about.
Well, I'm hoping that most people know what a nurse practitioner is, but maybe I should start out with what we do. And we're master's prepared clinicians. We have a bachelor's degree and are registered nurses, and then we go on for further training, masters, and some of us are doctorally prepared. So we're prepared to be fully independent providers. And in this state, we deliver a lot of the care in the underserved and rural areas. So we feel that we can really help be part of the solution because we can deliver that care, but right now we have a problem with access. And so we think that if some of these barriers were removed, we could really impact not only the access of care to the citizens of Florida, but also the costs. For instance, in 2010, the Florida Senate commissioned a report on the nurse practitioner workforce and what we could do. And they estimated at that time that if we had full practice authority and the barriers of physician supervision were removed, we could actually save between $7 and $44 million every year in Medicaid costs alone. That kind of speaks to you. And we could save as much as $333 million across the Florida healthcare system. So we're talking about utilizing a workforce that's prepared to deliver the care that this state needs and have an impact on the financial aspect as well. Also, Florida leads the country in health professional shortage areas. We are #1 in the country. And what that means is we actually are meeting less than 45% of the state's healthcare needs. And that's something that we need to address. And as you all know, the shortage with primary care providers is going to just get worse. And as we have this migration into Florida of elderly population retiring, and we're trying to attract families and other people, we really need to increase our primary care services. And nurse practitioners are really positioned to do that, but we need those barriers removed. It would really increase access significantly to care for the citizens of the state.
Well, thank you, Janet. And that's a key part of our plan, that we have enough capacity to serve the growing state. You've probably heard over the last couple of days that we're going to have 6 million more people calling Florida home, and a majority of them are going to be over the age of 60. And we know that as we age, we consume more healthcare services. So this is going to be a key component of going forward. If we accept the federal dollars and broaden coverage for our uninsured, who's going to treat them? And this is a key component that we need to ensure that we have enough capacity in our system to handle an influx of new enrollees in a Medicaid system or new citizens by 2030. So very important. We're going to get to a little bit more of a dialogue now, and I wanted to open this up to questions amongst the panelists. And I'm going to key a couple off real quick. And this goes to Janet. How we're moving the physician supervision requirement for advanced practice nurses impact healthcare in Florida. So you talked a little bit about it, but there's legislation in both the Senate and the House right now to remove some barriers that you talked about.
There is.
What are the obstacles to getting those bills passed and to the governor's desk?
Well, the supervision of the physician supervision requirement really ties our hands in some ways. For instance, it allows for duplication of services and added expenses, especially when we talk about impaneling nurse practitioners on private and public insurance panels. For instance, in Medicaid managed care, some of them only recognize the nurse practitioners as part of their physician team. If the physician that they work under or have a protocol with does not accept Medicaid, we therefore cannot be reimbursed under that plan, therefore we can't provide services. The other issue is in some areas where we need to prescribe cough medicine or cough syrup or something like that, we're not allowed to prescribe controlled substances in the state. So that means a duplication of services. If we have our patients and we're in a rural area, say Arcadia or something like that, and our supervising physician is in Tampa or Sarasota or somewhere else, and we have the need to prescribe something like that for a patient, we then have to tell our patients they now need to see another provider because we can't offer them those services. So that adds duplication of services and also cost to the system. The same with ordering things in the hospital situation. So if I'm a nurse practitioner in the hospital, I'm working in the ER, and I have a patient that fractured a leg or whatever and needs a pain medication right there in the hospital, I can't order that. I have to wait until the physician is free. The physician then has to go back and see the patient and then write the order for controlled substances. And by the way, a physician assistant is allowed to have that privilege, but nurse practitioners aren't. So again, duplicating services, adding costs and burden, making the patient wait. Those are all things that would be eliminated if we could eliminate the supervisory requirements for the physician. And the supervisory requirements are simply that you have this piece of paper that's a protocol. There's no requirement for chart review, patient visitation, or any other requirements. It's just that you have a piece of paper signed by the physician. And we always collaborate with physicians. Many of us work with physicians. We actually hire a physician to be our supervising physician, and that adds cost as well because we have to pay somebody to supervise us. Yeah, I know, it seems kind of counterproductive, but those are some of the barriers that we're facing with that supervisory requirement. And 19 states and the District of Columbia in this country have full practice authority where there's no supervisory requirement. And Florida is the last state in the nation that doesn't allow controlled substance prescribing by nurse practitioners. The last state. So 49 states allow it. That says something to me right there.
Well, Janet, you know that the Florida Chamber, our board has adopted the rally cry of the nurse practitioners, and it's part of our platform, and we'll be supporting that in both the House and the Senate this year, and hopefully we'll get it over the goal line.
And real quick, we have a couple bills outstanding. We have House Bill 547 by Dr. Pigman, and we have House Bill 281. And then we have the Senate Bills 532 and 614 by Dr. Denise Grimsley. So support those bills for us.
Yes, ma'am, we will. Let's pivot to Kelly. Kelly, we've also seen several bills this session that target eliminating step therapy policies or fail-first protocols, and this deals with prescription drug cost and how doctors can prescribe and mandates on what drugs are covered by insurance companies. This is a very controversial issue that has pitted the House versus the Senate. Can you talk a little bit about why step therapy policies are important and why we should preserve that protocol?
Okay. For those of you that may not know, step therapy protocols are established to allow patients to try a less expensive version of a drug as part of a prescription treatment regimen, stepping up to a more expensive version of that drug. And in many cases, actually in all cases, these step therapy protocols are defined by clinical societies, by medical professionals to treat people with chronic conditions who need ongoing prescription regimens to make sure that they use the most effective drug possible. And so this is not a case of prohibiting doctors from prescribing medications that they believe are in the best interest of their patients. This is a process of going through to make sure that the right drug is prescribed for that condition and that it is provided in the most effective manner possible from a cost and from a safety standpoint. There are cases where the American Diabetes Foundation, for example, has established step therapy protocols for the treatment of type 2 diabetes. There is a specific drug that says on its website, this is not the first treatment that you use for treatment of type 2 diabetes. So these are established practices that are in place by medical associations, by medical professionals to drive patients toward the most effective drugs possible. And the reason that's a big deal is one of the things we have seen is how important it is for patients to maintain their prescription drug regimen. And their out-of-pocket costs for those drugs have a significant role in how effectively those regimens are maintained. If someone is responsible for out-of-pocket costs for a very expensive drug, they are less likely to maintain that course of treatment. That then reduces their health status, and then they end up in this cycle of having to go back and start over with that treatment regimen. So again, it's not a matter of telling doctors what they can and can't prescribe. It's follow those established protocols that have been established by those medical societies, those medical professionals, to make sure people get the right drugs at the most cost-effective manner possible that helps them maintain their use of that regimen and improve their health.
Anything else? If not, let's wrap up this panel, and I'd like to thank all of our panelists here. Thank you for your attention and time and questions, and I hope you have a great day this afternoon when we go to the Capitol. Thank you.